This is Jim, Joan, and Wayne. Wayne. Jim is experiencing dramatic changes with what he's had in the last couple weeks, and Joan has been videotaping it. We're having dentistry done on us, and we do it to people without really looking at the total systemic effect that some of these may have. It just makes it for better dentistry. And so Jim's has a complex treatment plan, so we're getting started. This would be an opportunity just to catch them up on what you've experienced in the last couple weeks. We have you on tape for part of it, but you had an interesting observation about how you've been sleeping and feeling during the day, and I'd be curious to hear your side of it.
Sure. I had high blood pressure, and I've been taking pills, and I don't like to take pills, and but I felt like the better part of valor was to do that because I didn't want to have a stroke. So as soon as you put the appliance in my mouth, the blood pressure went down immediately, and I was shocked, to be honest with you. I thought, you told me that it might happen, but the fact that it happened instantaneously was pretty amazing to me. And I had taken a pill that day, and it went down to normal immediately. And that evening, or the next morning, it went back up. And so I called you and said, "Whoa, what's this all about?" So I came in and you did some adjustments, and it went back down. And so whatever we're doing, it seems to me that it's science. For every action there's a reaction, and you can put an appliance in my mouth and it does something to my body, but somehow you know how to adjust it to where my body adjusts, and it has stayed down consistently for over a week now. And at first I thought, well, maybe this doesn't work for me because it went down and then went back up. And then when you adjusted it correctly, my blood pressure is normal.
Your explanation is very good about having almost an odd response that since it was going down, you would hope it'd stay down.
Right.
But to your best explanation that we've given you, what happened that would make it go back up? The need for what?
Oxygen.
Yeah, and so that changed when you had this relaxation response, and the tongue was moving out of the way, and then as you relaxed and your body posture changed, then the tongue is not going through the grooves and over the top of the tooth quite the way it was the first day or so, and that's why you have to come in and get another tune-up.
Wait. Did you catch that? Jim had a shift. His body and posture adjusted to the new tongue location. The tongue no longer was coming into the mouth as it did at first. Jim's blood pressure went up because he needed more oxygen. An adjustment to the appliance will realign the tongue to the next new position. Let's listen to that again.
So your explanation is very good about having almost an odd response that since it was going down, you would hope it'd stay down.
Right.
But to your best explanation that we've given you, what happened that would make it go back up? The need for what?
Oxygen.
Yeah, and so that changed when you had this relaxation response, and the tongue was moving out of the way, and then as you relaxed and your body posture changed, then the tongue is not going through
Right.
the grooves and over the top of the tooth quite the way it was the first day or so. And that's why you have to come in and get another tune-up. But just-
Not, it's been amazing to me because you told me that my body was functioning on adrenaline constantly, and I ran track in high school and college, and as you mentioned that, I felt like I was always on the starting blocks waiting for the gun to go off, and so my trigger was short, and I feel calmer inside. People can cut me off in traffic. I still don't like it, but I have a lot longer fuse.
You put the
than I
gun
did.
in the glove compartment?
Yeah, and things just don't seem to be bothering me the same way. I still recognize them, but I'm not. I don't have just a real short trigger on it.
Right.
And it's not that I was angry or anything. It's just that it increased anxiety in me much faster than it does now.
So, you also said something about the steps at where you were working. Sometimes would be a challenge for you, and other times they weren't. But of late, there's no challenge.
Well, I've always been very agile. I know I'm getting older, but even at home, I was realizing that I was being more careful. And then I didn't even think about it, but the other day I just came bounding down the steps and I said, I can't do this. I guess this is all part of it because my energy level seems to be going up. I don't seem to be as resistant to trying to stand up and sit down and go up and down
Right.
steps.
I think you mentioned something about getting out of a chair was less of a problem too.
It is.
Yeah.
Yeah, it is. So,
So in that case, when we heard you the first time talking about just getting old, we renamed you. What did we name you?
young man.
And this is a very powerful thing because you speak a truth. If you do this enough, you really believe it. You're not taking a chance. So we've started just taking what people say and turning it around to a positive and identify that as a reality. Even though he hadn't experienced it yet, when it started happening, he had a foretelling of this going to happen. It solidifies. This is the true reality. I'm not old. I felt old, but Jim's actually getting younger as his chronological age is progressing forward. His ability to act and function has been optimized. And we do that all the time anyway in dentistry. There are these reactions and results of what we do. We just can do this so much better that we can actually provide new and different functioning for a patient that had settled for less because everybody kept saying, everybody, the medical profession as well as everybody we know said, well, Jim, you're just getting older. But you're just getting better, Jim, and you're younger.
Well, I can tell that I'm breathing deeper. I mowed the grass the other day and I came in and I was feeling pretty good. And I took my blood pressure and it was still low.
Yeah.
And
so he's doing vital monitoring outside of the professional setting because he's just checking himself. But we've optimized now and eliminated the lifelong need for some of the medications. We're not against them,
No.
but we're against them if they're not needed, if there's another way. Up until now, there hasn't been a whole lot of discussion about other ways. Diet, nutrition. Joan's a health coach and lives that lifestyle, and there are other ways, but a lot of times the fundamental or basis to life is breathing. So if that's compromised, all this other stuff is just icing on the cake unless you get some air in there.
well, you told me to work with my doctor. I've been trying to get in touch with him, but I haven't taken my pill for blood pressure for over a week. I don't know if I should
Really?
use it.
You haven't taken your blood pressure medicine?
In over a week.
Over a week.
Good
And
for you. Good for you for taking control of your own health.
well, if I do take it, I'll pass out.
Because it'll drop too low.
So yeah, and I'm trying to get in touch with him,
Yeah.
and I have been monitoring it and recording it so that he can see, because I don't want him to pass out, you know. But I know enough to know that if I take that pill, it's going to go way too low.
Right.
And,
That's astounding. Good for you.
And
Good for
they
you for
should-
taking the bull by the horn. Yeah.
Thank you.
Yeah, you
So-
are in charge of your own health care.
and I-
Dr. Whitley is emphatic that his patients work with their doctors as their oral system is balanced and their health improves. The vast improvement in Jim's health in just 1 week is not unusual to Dr. Whitley's patients. Of course, each patient is unique and results do vary. Dr. Whitley has an 85% success rate. He also quips, "If anyone says they have 100% success at anything, run the other way."